Hi, welcome to Outreach with Dr. Beach, and today I'm going to talk about the important topic of suicide. Now, according to the World Health Organization, one person dies from suicide every 40 seconds, which is quite an alarming statistic. And suicide affects people of all ages, from all places, and all socioeconomic demographics. And in fact, suicide is one of the leading causes of death throughout the world, and particularly among people under the age of 35. The topic of suicide is particularly emotional and personal to me, as I've lost 3 loved ones to suicide over the years. And I recall in each of those cases experiencing a host of emotions ranging initially from shock and disbelief to overwhelming sadness and grief, and then to anxiety as to whether there's anything I might have been able to do to see the suicide coming or prevent the suicide from happening. And that brooding anxiety that you feel can even make you question your own mortality when someone you love so much has lost their life to suicide. And you can have survivor guilt, which is something you commonly hear among people who have lost a loved one to suicide. And certainly survivor guilt and losing a loved one to suicide particularly increases the risk of suicide. Now, of course, suicide, as I mentioned, affects people throughout the world. There is a particularly heightened risk among people who have mental health challenges. And the mental health challenges that increase the risk of suicide run the whole gamut, from depression to certain types of anxiety, for example, trauma or post-traumatic stress disorder, particularly substance use, schizophrenia or people who have psychosis, and then people who have certain coping styles or personality styles that make them at a heightened risk of suicide. Fortunately, there's been an abundance of research on suicide over the years, which can help you and I better understand what places someone at a higher risk of suicide, and by contrast, what are those factors that can protect or reduce the risk of suicide. Now, some of the factors are more static, meaning they don't change, yet we ought to keep them in mind because they continue to heighten the risk of suicide. Examples of those would be males compared to females. Now, interestingly, females actually attempt suicide much more often than males. However, males are much more likely to complete suicide. And our best understanding of that is that males compared to females tend to choose more lethal means, like hanging or firearms, whereas on average, women are more likely to engage in cutting or overdoses. Other static factors that increase the suicide risk are that suicide runs in families. So there's known to be a genetic relationship with respect to suicide, and it's not uncommon that when you see a suicide within a family that you'll see multiple suicides within that family. So that could be genetic, or as I mentioned previously, that could be due to the increased risk of, for example, losing a parent or a child to suicide, and the associated grief or increased risk that stems from that. And then there are factors like having a chronic medical illness, and that's in contrast to an acute medical illness, because we know from the literature that it's particularly difficult to cope with a chronic medical condition where you don't have a sense that things are necessarily going to get much better or that you're going to be cured. So what can we do to help ourselves or a loved one who's struggling with suicidal thoughts? One of the first things to do is to explicitly ask other people whether or not they're having suicidal thoughts, and to validate someone and normalize what they may be going through. So for example, you could ask, "Hey Johnny," if that were actually his name, "I can imagine given what you've gone through recently and how you're feeling, that it would be only natural that at times you might feel hopeless or helpless, or even that life's not worth living. And it's important that we ask explicitly about suicide because it can seem natural to shy away from that topic. And especially in this day and age, it's really important to limit or even eliminate all negative, traumatic, or even pro-suicidal content that we may see on social media, and to not be exposed to the horrors of topics like cyberbullying. And it's also important that if we or a loved one is suicidal, that we're very assertive in helping that person remove access to lethal means like firearms, or ensuring that someone hasn't stockpiled medications that could result in an overdose. And it's important to remember that there are effective treatments available and that brighter days are ahead. And look, the sun just came up and it doesn't have to hurt this bad. And those treatments range from individual to group or even family treatments, and they can be a combination of various talk therapies or medication therapies, where medications can help to alter brain chemistry. If you or someone you love is suicidal, it's imperative to ask for help and to reach out to your local resources. Thanks for tuning in to Outreach with Dr. Beach.